Back from Caring Medical Center, I'm so happy to welcome our next guest to the show. Dr. Timothy Special is a prolotherapist at Caring Medical. And joining him this morning once again is Dr. Bill Sawyer, who can tell us firsthand how prolotherapy was able to help him. Good morning to both of you.
Morning, Carly.
Good morning. Welcome back. All right, so let's talk about Dr. Sawyer. We've met you before. You're a triathlete. You're very active, which all of you guys are on your team, by the way. Tell us a little bit about your story this morning and how prolotherapy was able to help you.
Well, I first learned about prolotherapy 10 years ago. I had very severe plantar fasciitis, and I could no longer run, and I had a marathon and a full Ironman coming up. And Tim treated me in 2005, both feet.
Still friends.
Still friends. Good. That says a lot.
But I've never had any problems since.
Okay.
And I've, since then I've been 4 full Ironmans and a lot of different races and events.
So first with your feet and then your knee, unfortunately, right?
running downhill at high speed up in the northern states, and I tore my left meniscus very severely.
Very common injury, though, by the way, right? For certain athletes.
That was about 4 years ago.
And then how are you feeling today after prolotherapy?
Good. I'm back running.
Yeah?
I've run the Naples half, and I run about 4 times a week, and I swim mainly. But yeah, no, I'm fine.
Wow. Talk a little bit about kind of what that is and what this injury, as we kind of said, it is a pretty common injury. You've had it yourself, right?
Yes. Well, Carly, thanks. This is the knee joint here, and it is very common. People think it's just a hinge joint. You look at it, but it really isn't. There's a lot of rotation, and people hear about I tore my meniscus or cartilage, or I tore my ACL. If you can see this here, that's the anterior cruciate ligament. And what happens is with a lot of these injuries, these are ligaments here on the side. Our body's made up of ligaments and tendons, and they get very, very weak and stretch. People can see that. Now, if it's a minor stretch, many things can be healed. But many people have incomplete healing. And the trouble is, so they're living with they're taking anti-inflammatories, as Dr. Sawyer said, and they're masking their pain. They get incomplete healing. They go to the emergency room. Right, and then it comes back and say, how come, doctor, I still feel this? And so what we do here was developed by Dr. Hackett in the 1940s. It's called prolotherapy, means proliferant. And our bodies, we inject irritants, a natural healing things such as dextrose, or maybe platelets. You've heard of platelet-rich plasma. We inject these in the areas to basically give our body a supercharge. And about 85 to 90% of cases, people get healed. My own case here, when I was 19 years old, this was way, way before prolotherapy. It was there, but I didn't know much about it. I tore my medial and lateral meniscus. So I went to my mom was a nurse, I went to the orthopedic surgeon, and they took out my cartilage, my medial and lateral meniscus. I did great, was still running, playing racquetball, tennis, golf, everything, and then about 15, 20 years later, my knee really got real bad. I would have like a balloon in my knee. I'd have like 120 cc's of fluid, which is a lot of fluid. I was a doctor, so I would take out the fluid myself, go back to work, and saw 3 specialists, and they wanted to rebuild it. I flew out and saw Dr. Hemwell, who was a premier student in prolotherapy, and he treated me. And I got better. And many years later, once in a while, Dr. Hauser will give me a reboost, okay? But I'm a walking miracle because I was unstable. I'm walking around no cartilage, but no pain because my ligaments are tight. So I take nutrients, I exercise, and I get prolotherapy periodically.
Well, and what's interesting is I think, as we've talked about prolotherapy, I think a relatively new concept for some of us here in Southwest Florida that are, hearing about it for the first time, but it has been around for a number of years. You've been doing this for over 20 years, right?
Yes, I have. Many, many years. And it's a very safe procedure. I think patients come to us, Carly, all the time and say, how come no one told us about it? We don't learn it in medical school. We don't learn it in residency. It's usually word of mouth, okay? And now we've done a lot. It's becoming more and more known through research because we are starting to do more research. But I think people are kind of finding out that not that surgery is not important. We have some great surgeons. We need surgery.
And you're very honest about this. May not work for everybody.
No, I had a patient just last week, I was telling you before, actually, and his hip was too far gone, for prolotherapy. And so you need a really good orthopedic surgeon to have a total hip joint, okay? But most cases really do not need it. This is a non-surgical option.
So this is just another option to really make sure people are knowledgeable about and maybe before surgery.
Absolutely.
Is that kind of your message, as we close here? And what do you want people to know? I mean, if people are a little hesitant, if they haven't heard of prolotherapy yet, what would you like to tell them? What's your message?
My 87-year-old mom, who before she had prolo, couldn't even walk. And,
wow.
and now when I saw her in New York State about a month ago, and she was telling me how she now walks through Wegmans, big shopping.
Oh, I know Wegmans.
Without her walker. So, yeah.
Yeah, well, we love that there are more success stories, hopefully more to come here in Southwest Florida. Thank you both so much for being here this morning.
Thanks for having us.
Easiest thing to do if people want to find out more about prolotherapy in your office is to do what? Call?
Well, just call Caring Medical. It's www.caringmedical.com. We have a great staff. We have a great website, YouTube videos, and people can just check it out and see if something we can help you with.
All right. Thank you both so much. Good luck with your upcoming events. And of course, for more on Caring Medical Center, all you have to do is head to our website, foxforwarningblend.com.
And one last check at today's Fox forecast, and we'll be right back.